Hi, my name is Beck Reyes, and I'm a pediatric nurse practitioner. And today I'm speaking on behalf of Neurelis about VALTOCO, an intranasal diazepam nasal spray for the immediate use of seizure medication for the acute treatment of intermittent stereotypic episodes of frequent seizure activity that are distinct from a patient's usual seizure pattern in patients with epilepsy 2 years of age and older. Neurelis recommends school nurses follow all institutional and school district policies, seizure-safe school legislation, and applicable state laws and guidelines. Remember to be familiar with your student's seizure action plan prior to the administration of immediate use therapy, such as VALTOCO. Today, we're going to talk about episodes of frequent seizures, what they are, why prompt intervention is critical, how to manage seizures in the school setting, how to develop meaningful seizure action plan, and set management goals for your students with seizures. VALTOCO, what it is, how to use it, and some important safety information. And then lastly, we're going to talk about resources that are available to you as you take care of these students on VALTOCO. Epilepsy affects nearly 3.5 million people in the United States, and of those, about 470,000 children have epilepsy. And of those 3.5 million individuals, about 1 in 20 will still experience episodes of frequent seizures. And what are frequent seizures? They are multiple seizures, typically 2 or more, that occur within a given time period, usually less than 24 hours. What's important for you to note is that they are different and distinct from your student's usual pattern. Sometimes they're called by different names. Sometimes they're known as seizure clusters, acute repetitive seizures, flurries, multiple seizures, repetitive seizures. No matter what they're called, it's important for you to know what your student, their family members, and healthcare providers refer to their seizures as. In 2017, the International League Against Epilepsy had updated the way in which we categorize seizures. And we did that so that we can standardize the language around seizures so that no matter where you are, you know what type of seizure a patient were to have. And the first kind was categorized as focal, and it can be further categorized into preserved consciousness or impaired consciousness. And that seizure can turn into a focal to bilateral tonic-clonic seizure. The second type is unknown, meaning that we haven't quite figured out where the seizures are coming from, whether they're focal or generalized. And they too can be further categorized into preserved consciousness or impaired consciousness. And that can be a bilateral tonic-clonic seizure as well. The last category is generalized, which is always accompanied with impaired awareness and can be categorized into absence seizures or other generalized seizures. And it can also progress on to generalized tonic-clonic seizures. What's important for you to know is that no matter what your student is categorized as, episodes of frequent seizures can occur throughout any of these seizure types. And it's important to have rescue treatment on hand to manage these episodes of frequent seizures. Delayed treatment may lead to serious outcomes. We know that increased seizure duration and delays in immediate use seizure medications have been repeatedly linked to negative outcomes. And that's why prompt treatment is important and should be initiated as soon as possible. We know prompt treatment can lessen serious outcomes. Having an immediate use seizure medication on hand allows for the earliest possible treatment. Let's talk about management goals and how to manage these episodes of frequent seizures in the school setting. It's important for you to be able to identify triggers that can put your student at risk for seizures. The benefit of identifying triggers helps recognize periods of vulnerability. And some examples of this could be a lack of medication adherence, periods of medication change, sleep deprivation, concurrent illness, stress, hormonal changes, consumption of alcohol, or any flashing lights or other triggers that are identified in that student's seizure action plan. The National Association of School Nurses had updated their evidence-based clinical practice guideline. And in collaboration with your student's HCP, we want the professional nurse to advocate for the least invasive medication choice in this child's environment. Now we have multiple FDA-approved immediate use medications on the market. The Epilepsy Foundation has a nationwide initiative to pass Seizure Safe School legislation, mandating that schools provide appropriate care and treatment. There are 5 key components to this legislation, including requiring school personnel to complete seizure recognition and first aid response training, having a seizure action plan on file, which ensures the administration of any prescribed FDA-approved medications in these students living with epilepsy, education and training of students about epilepsy and first aid response, and the Good Samaritan Clause. This is what a seizure action plan should look like. It should address when to treat, how to treat, the expected response, and when to seek emergency assistance. If your school does not currently use a seizure action plan, anyone can initiate one. And these advocacy groups have access to templates in various languages that you can use to develop your student's seizure action plan. Now let's talk about VALTOCO, a diazepam nasal spray, what it is and how to use it. So VALTOCO is the first and only FDA-approved diazepam nasal spray for episodes of frequent seizure activity. It is now approved in students as young as 2 years of age and older. VALTOCO is small and discreet, and it's created for safe administration by non-medical folks to be able to take care of these students with epilepsy. It's important to note that VALTOCO is not a replacement for daily anti-seizure medication and should only be used as rescue treatment for these episodes of frequent seizure activity. The FDA has deemed VALTOCO clinically superior to Diastat because of the route of administration. VALTOCO has been deemed by the FDA to be clinically superior to Diastat in patients 6 years of age and older. I really like this quote here. In the context of when this drug is to be given, typically in the middle of a seizure event, it is inherently easier to administer the drug to a patient intranasally than rectally. VALTOCO is made up of 3 components. Diazepam, the active ingredient in VALTOCO and Diastat, has a relatively long half-life versus other benzodiazepines, which may contribute to sustained drug levels. It's also comprised of Intravale, which increases drug absorption across the nasal mucosa by transiently loosening tight cell junctions and increasing the permeability of cell membranes. VALTOCO also utilizes vitamin E, which increases the solubility of diazepam to allow for adequate concentration in a small volume of nasal spray. After VALTOCO administration, diazepam rapidly entered the systemic circulation at concentrations that have been demonstrated to reduce seizure activity. Easy administration is key. VALTOCO uses the same nasal spray device as other FDA-approved products, such as Narcan and Neffy. Some key features is that it can be administered by non-medical care partners. Nasal delivery avoids first-pass metabolism. Medication is ready to administer, so it's important not to prime. And then it's readily accessible, and it's got one-handed delivery and 360-degree functionality, meaning that the device can be in any position when you administer it to your student. In a phase 3 open label repeat dose safety study in patients with epilepsy who experienced episodes of frequent seizures, we took a look at the safety of diazepam after repeat intranasal doses of VALTOCO in patients 6 to 65 years. It was an open label study, meaning that the individuals knew that they were taking VALTOCO. Some key inclusion criteria included that these patients were still experiencing seizures, frequent seizures, despite being on anti-seizure medications. And some of these individuals were on benzodiazepines as their baseline anti-seizure medications. We also took a look at dosing based on the subject's weight and age. And what we found was that VALTOCO stops episodes of frequent seizures fast and is most effective when administered early. So taking a look at with patients with epilepsy age 2 years of age and older, VALTOCO was rapid. The median time to seizure cessation when administered within 5 minutes of seizure onset was 2 minutes. A single dose of VALTOCO could achieve all-day control. So VALTOCO is reliable. 87% of seizure episodes used a single dose over a 24-hour period. VALTOCO helps patients get back to their lives. VALTOCO leaves patients ready. A majority of patients aged 6 years and older return to their usual selves within 1 hour of VALTOCO administration. Across VALTOCO long-term open-label safety studies, treatment-related somnolence never resulted in treatment discontinuation and was reported in 1.8% of the individuals that were 6 to 65 years of age and 2.9% in the patients that were 2 to 5 years of age. VALTOCO helps patients get back to their lives. Overall, we had taken a look at these individuals, and the majority of patients had an overall mean sedation level that were considered low, mild transient, and not considered clinically relevant. Clinical data from analysis of open label safety study of VALTOCO recognized that it was rapid. When administered within the first 5 minutes, the median time to seizure stop was about 2 minutes. It's reliable. 87% of seizure episodes use a single dose over a 24-hour period. And a majority of patients aged 6 years and older were back to their usual selves within 1 hour of administration. When we asked patients and caregivers how easy was it to use VALTOCO, 90% of the patients said that it was extremely easy or very easy, and 79% of these patients had reported that they were comfortable using it outside of the home. When we asked the caregivers, 100% said that it was extremely easy or very easy, and 90% were extremely comfortable using VALTOCO in a public setting. VALTOCO is now approved in individuals with epilepsy 2 years of age and older for the acute treatment of intermittent stereotypic episodes of frequent seizure activity that are distinct from a patient's usual seizure pattern. A study called STELINA evaluated the safety and tolerability of VALTOCO in pediatric patients with epilepsy aged 2 to 5 years of age. The primary objective was to assess the pharmacokinetics of VALTOCO within this age group. And we took a look at the 5, 10, and 15 milligram doses based on the patient's weight. It's important to note that there is a 20 milligram dose available, but it was not evaluated in this age group. Some key inclusion criteria is that these patients had a clinical diagnosis of partial or generalized epilepsy with motor seizures or seizures with clear alteration of awareness, and they may have needed a benzodiazepine for seizure control. And what we found was that the pharmacokinetic data supported the 0.5 milligrams per kilo dosing paradigm. In your younger patients, they have a faster metabolism, meaning that they may require a higher dose based on weight at younger ages. What we found was VALTOCO 10 milligrams was the most common dosage across all age groups, and the mean exposure was similar across all age groups, supporting the similar PK profile between patients 2 to 3 years of age and 4 to 5 years of age. Patients aged 2 to 5 years had comparable PK data profiles to children aged greater than 6 years of age. Here's a summary of VALTOCO safety and tolerability in patients aged 2 years and older. Some key findings were that there were no discontinuations that were considered treatment-related, no serious adverse events, and no treatment-related TEAs were considered life-threatening. The most commonly reported local adverse events were nasal discomfort, dysgeusia, epistaxis, and rhinorrhea. Here is a summary of VALTOCO safety and tolerability across the 6 years and older studies and the 2 to 5 years studies. In patients aged greater than 6 years, some of the most common treatment-related TEAs were nasal discomfort and headache. And in the group 2 to 5 years of age, there were 8 treatment-related adverse events that are listed here. Let's talk about how to use it. What's great about VALTOCO is that you can individualize your patient's dose based on their weight. It's important to note if there are any big growth spurts or weight loss and notify the patient's healthcare provider because an adjustment in their dose may be required. For those of you that have been taking care of patients on VALTOCO, you might remember the 2-dose boxes. And there had been some discrepancies between the number of doses that had been dispensed by pharmacy versus what the HCPs were prescribing, leaving these patients with epilepsy unprepared for episodes of frequent seizures. So now exciting news, VALTOCO comes with 5 doses in each box to ensure that students are prepared at home, school, and beyond. The packaging differs by your patient's dose. So you'll see that it's color coordinated based on your patient's dose. The number of sprays that they require in order to get the entire dose depends on the dose of your patient. So you see here for your 5 and 10 milligrams, they require just a single sprayer in order to get their dose. And here are the instructions for use for the 5 and 10 milligram. You would remove the sprayer device from the blister pack, and this is what it looks like. And there is a nozzle and a plunger. And what you would do is you would gently insert the nozzle into your patient's nostril, and then you would push firmly down on the plunger. For patients that require higher doses, such as the 15 and 20 milligrams, that they will require 2 sprayers in order to receive the entire dose. And so the instructions for use are the same. You would remove the first sprayer from the blister pack. You would gently insert into your patient's nostril, and then you would push down firmly on the plunger. And when you were done with the first nostril, then you would administer the second half of the dose in the second nostril. It's important to note that your student does not receive the entire dose until both sprayers are utilized. VALTOCO is rapid, reliable, and ready intranasal diazepam for immediate use seizure medication. It's rapid. When administered within the first 5 minutes, the median time to seizure stop was 2 minutes. It's reliable. 87% of seizure episodes used a single dose over a 24-hour period, and your patient is ready. A majority of patients aged 6 years and older return to their usual selves within 1 hour. Again, it's important to note that VALTOCO has a clinically superior route of administration over Diastat in patients 6 years of age and older, and provides a major contribution to patient care. Let's talk about some important safety information. There are risks from concomitant use with opioids, and it can lead to abuse, misuse, addiction, and even dependence and withdrawal reactions. It's important to note that concomitant use can lead to profound sedation, respiratory depression, coma, and death. And so we should reserve concomitant use for individuals whom there are no alternative treatment options. The use of benzodiazepines, including VALTOCO, exposes users to risks of abuse, misuse, and addiction, and that can lead to overdose or death. The continued use of benzodiazepines may lead to clinically significant physical dependence. Therefore, if you need to reduce or take your patient off of a drug like VALTOCO, it's important to do it incrementally and not stop abruptly. Contraindications. VALTOCO is contraindicated in patients with hypersensitivity to diazepam or acute neuroangle glaucoma. VALTOCO is a central nervous system depressant, and so we caution against any use of engaging in hazardous activities that require mental alertness, such as operating machinery, driving a motor vehicle, riding a bicycle, until we really know how this drug affects your patient. A class warning across all anti-seizure medication is suicidal behavior and ideation, and that includes VALTOCO. So if your patient has any worsening depression, suicidal thoughts or behavior, or unusual changes in mood, it's important to let their healthcare team know. Again, it's contraindicated in patients with glaucoma because it can increase intraocular pressure in these patients. We don't really know how the use of VALTOCO will impact neonates, especially in late stages of pregnancy, and therefore it's important to monitor any signs of withdrawal and manage these neonates accordingly. There is a risk of serious adverse reactions in patients that are infants due to benzyl alcohol preservative, and it can lead to something called gasping syndrome. And so therefore we want to reserve the use of VALTOCO in patients 2 years of age and older. Some adverse reactions included somnolence, headache, and nasal discomfort. For full prescribing information, you can check that out on the website. Here are some resources that are available to you. Minorellis offers support for nurses and care partners, and so you have access to nurse educators who can give you virtual training on how to use VALTOCO. In addition to that, you can order demo kits such as these and use the training sprayer that I was using during today's presentation. It's important that you become very familiar with the training device well in advance of having to actually administer VALTOCO. There are also some resources that are available, including frequently asked questions, more information about VALTOCO, and then an advocacy letter for parents that are interested in VALTOCO for their child. Additional nurses include resources from these advocacy groups. In summary, we want you to advocate for the compassionate choice for your students. VALTOCO is the only on-hand nasal immediate use seizure medication for students with epilepsy 2 years and older with episodes of frequent seizures. It's rapid, reliable, and ready to use nasal spray. It's been deemed clinically superior because of the route of administration over Diastat, and it empowers nurses like you, teachers, and other staff members to administer VALTOCO confidently. Thank you for your time today. If you have any additional questions that we haven't answered so far, you'll have access to our school nurse resources by clicking on this link or scanning the QR code below.